In this video, I explore asthma. So the reason that I am doing these breathwork training and learning these breathwork exercises is really because of asthma, because I was diagnosed as a young child with asthma. I lived with it for most of my adult life. The image that you see here are the last 3 inhalers that I was prescribed by a doctor as an asthmatic. And these are very strong inhalers. 2 of them are steroid inhalers. One of them, the Ventolin inhaler, is for emergencies. The blue one is for emergencies. I know many people who have these inhalers. So these were the last 3 inhalers, and I stopped using them several years ago. And I framed them, and I've put, you can see the words there, in case of emergency, don't break glass, because I never want to use them again. I never felt good using inhalers. I always felt that I was sort of stealing from my future. In the moment, it might help me breathe, but I always felt there would be a long-term cost to using these inhalers. So asthma is very prevalent. I was just looking at the statistics from the National Health Service in England, and asthma, there are 1 million children in the UK with an asthma diagnosis, and there are 12% of the population with an asthma diagnosis. So it's very prevalent, and the typical treatment is to give inhalers or steroid inhalers. And I was using these just to manage my asthma. If I was doing sports, going to the gym, I would take the inhaler before, or in the cold winter months, I would have to use the inhaler because my chest would become very contracted, and I would need to use the inhaler to breathe. I was always breathing through my mouth. I was eating foods which were not good for me, very inflammatory foods, and I was stuck in this vicious cycle. And no medical professional in the National Health Service ever sat me down and developed an alternative plan, talked to me about breath work or any other practice or exercise that would help me. All they did was give me these medications, which is very common. So a lot of this work, this breath work, and it came from the work of K.P. Butekyo, Konstantin Butekyo, who was a doctor. I think he was a Ukrainian doctor working within the Soviet Union, and he was really he was working with people with breathing difficulties, and he was trying to understand the disease and really challenging the sort of the traditional or the medical ways of treating them. And he was treating his patients through breathing exercise. And this is a very important or very useful quote. So the noisy and heavy breathing of an asthmatic had always been considered an outcome of the disease. Nobody could even suspect that heavy breathing was the cause of bronchial asthma. An increased volume of breathing could provoke the appearance of the symptoms of the disease. Okay, so Konstantin Butekyo, he understood that the heavy breathing of an asthmatic, that's not a symptom of asthma, that is the cause of the asthma. And that if you could reduce the amount of air a person was breathing, that would, in many ways, that would heal the cause of asthma. And that was certainly my experience. When I started doing the breathwork exercises, started to measure and track changes in my respiration, and use the breathwork exercises to increase my tolerance to carbon dioxide, the cadence, the rate and volume of my breathing normalized. And when that happened, my asthma simply disappeared, and I do not have it anymore. I have not taken an inhaler in years, even though I was taking inhalers every day, several times a day. So a person with asthma typically breathes 15 to 20 breaths per minute. Now, someone who doesn't have asthma will be breathing maybe 6 to 10 breaths per minute. An asthmatic, each breath has a volume of 700 milliliters to 1 liter. So that's somewhere in the range of, let's do the math. 15 times 700 saves my, I'm way off. It's about 10 liters, I guess. And if it's 20 breaths at 1 liter, you're breathing 20 liters of air. So this results in asthmatic is breathing somewhere in the region of 10 to 15 liters of air per minute. Now, someone who has healthy, good, functional breathing, they might breathe the volume closer to 350 milliliters of air with each breath, which is half the volume of air, and at a much slower rate. So someone who is breathing, who's good, healthy breathing, they're breathing around half the amount of air in any moment. You could imagine you're breathing double, or sometimes in some cases triple the amount of air. Imagine you did that with every single meal. Like you ate double or triple the amount of food. Well, how much that would impact your body? You would gain a lot of weight, but it would also put considerable stress on the body. And that was certainly my sense of being an asthmatic. My body felt like it was under huge amounts of stress. If you had have asked me 5 or 10 years ago to draw a picture of my lungs, when I was asthmatic, I would have drawn a picture that was similar to the images that you see on a cigarette box of a damaged or unhealthy lung. That was my perception of my lungs, and I thought that my lungs were scarred and damaged and could not be healed. Well, my perception of my lungs now that I'm no longer asthmatic and that my breathing is good is completely different. It's the image of a healthy lung, sort of beautiful tissue, white lung tissue. So heavy chronic hyperventilation, heavy breathing volume occurs continuously, not just during symptomatic periods. It is chronic, taking place every minute of every day. So asthmatics are always over breathing. They're breathing large volumes of air all the time, not just during an attack. And my nose was always blocked. I was always breathing through my mouth. I had many, many respiratory infections as a result. I would get chest infections. My nose was inflamed. I had operations on my nose to try and make it easier to breathe. All of these things, but I never really treated the disease. What I needed to do was change my diet so that I didn't have all this inflammation in my body, that my nose would be more, I could breathe through my nose easier. I needed to use mouth tape so that I would force myself to breathe through my nose. And I needed to do the breathing exercises so that I would become more tolerant of carbon dioxide. So comparison with overeating, people with asthma, COPD, and other respiratory complaints breathe 2 to 3 times more air than needed, equivalent to eating 6 to 10 meals per day. The practice contained in this module effectively reduced chronic overbreathing, optimizing both volume and cadence of rhythm of breathing. So asthma, people think that asthma, that the heavy breathing is the symptom of asthma. What Konstantin Butekyo showed was that it is the cause of asthma. And when we're working, when we're doing breath work, or if we're working with asthmatics, we can communicate that to them and teach them that it's that overbreathing that we're trying to change and to transform. Also, you will see with asthmatics the pattern of upper chest breathing. There's a lot of movement of the chest and rib cage as someone's breathing. And we need to just sort of calm everything down and get that beautiful diaphragmatic breathing, which is especially when a person is at rest. So these are things that I'm working with a lot with my clients, both in as a yoga or breathwork teacher, mindfulness teacher, but also within therapy. I'm really working at all of these parts, trying to get the person to really transform their physiological sort of causes, the patterns of tension, the psychological, the biochemical. And just one last thing that of note is that as an asthmatic, what I experienced was a lot of stress. I felt very stressed out. I would feel that I always had this constant elevated level of stress. And when I was having an asthma attack, which was quite frequent, or at least I had, more symptoms, I would feel very irritable, very angry. I would feel very nervous, more anxiety. It really felt very difficult, the disease. And as I started to transform my breathing, I started to notice that my whole system began to settle and calm down. And, for people who, when we do the control pause exercise, which we'll look at in another video, for every improvement in the score of the control pause exercise, which is something that we use to track a person's breathing, for every improvement, what we notice is that the person feels much better. There's a sort of a massive or a significant or a proportional reduction in the feeling of stress and tension. So that's the value of these practices. So each part of it begins to reinforce and transform the other parts. But asthma, it's 12% of the population. It's your children, it's your cousins, your brothers, sisters, and parents. And it's not just asthma. Asthma is a name that we put on this disease, but many of our loved ones will be experiencing symptoms similar to asthma. They will be using medication to help them to breathe. And what can be deeply transformative is changes in lifestyle, exercising, mouth tip, breath holds, and just be consistent. And slowly over time, as was the case for me, your asthma can be healed, and you won't need to take these inhalers anymore. And then these inhalers were wonderful for me. They saved me when I was a child and through much of my adult life. But now I really don't ever want to take them again because they're not good. It never felt good. It always felt like I was borrowing from my future when I was taking them. And through the practices in this course, asthma can be transformed.